Hello, I'm here to talk to you today about the importance and the use of universal precautions in the setting of emergency medical services. Have you ever watched an episode of ER or like episode on TV where the characters are depicted wearing goggles, mask, gloves, and gown while they're treating a trauma patient and wonder why the overkill? Well, it's not overkill when you're the EMS provider in the streets treating the sick and injured, and you're trying to protect yourself, your family, and your friends from the deadly consequences of exposure to airborne and bloodborne pathogens. These pathogens can carry HIV, SARS, hepatitis, or other deadly diseases. This is particularly important to EMS personnel who are on the streets and in the homes of those that are carrying these deadly diseases. EMS is most at risk due to the sometimes chaotic and underlit situations in which they're expected to respond. My name is Matt McKnight. I'm a paramedic and firefighter of 20 plus years. I have intimate knowledge on the daily exposures that nurses, doctors, and especially first responders face on a daily basis. Today I'm going to describe some of these sources of exposure, the risk of these exposures on EMS, and the prevention techniques to isolate the chances of exposure to the EMS personnel. Now that we have identified today's goals, let's take a look at the problem EMS faces. The exposure sources are many. They're both bloodborne and airborne in nature. Blood is the most prevalent and can be encountered in traumatic or medical situations. Urine, feces, vomit, saliva, nasal secretions all can help transmit these deadly diseases. Semen, vaginal secretions, cerebral spinal fluid are less common in the EMS field, but also are a risk. We've now described the sources of these exposures. Now let's take a look at what the risks are for being exposed. Exposure risk for bloodborne pathogens, again, are HIV, AIDS, hepatitis, and STDs. Airborne risks include, but are not limited to, TB, chickenpox, smallpox, measles, influenza, SARS, and Ebola. Now we know the risk and the exposures. Let's determine the best practice for limiting that exposure. You'll see here a bloodborne exposure with an arterial bleed. The use of goggles and masks help us protect our eyes, our nose, and our mouth. The use of gown and gloves help us protect our clothing and our skins, and the gloves particularly for the protection of our hands, which are at risk due to small cuts, lacerations, or even a hangnail that leads us to have the ability to be exposed. In EMS, the paramedics and EMTs that are here to help the sick and injured are routinely putting themselves at risk for exposure to many diseases, many of which can be proved to be fatal. By following these universal precautions to help prevent exposure on their everyday and routine calls, EMS providers can help them protect themselves and their families from suffering of these diseases. I hope that you found this video helpful in understanding the sources and the risk of exposures to airborne and bloodborne pathogens, and how EMS personnel can properly protect themselves from exposure. Items discussed today were pulled from Guide to Infection Prevention in EMS, When Lysol Isn't Enough in EMS World Magazine, and Body Substance Isolation via Wikipedia. Thanks for watching.